In News 10 at 4, Your Health Today, we want to focus on the 8 health tests that women should get every year. We know it is confusing because of the ever-changing guidelines. And that's why local OB-GYN Dr. Nicholas Montalto is joining us today to try and sort it all out. And we want to start with the mammogram because that's been the most confusing lately.
Okay. There are some new mammogram guidelines, and it really depends on sort of what agency you're looking at to determine those guidelines. So the United States Preventative Services Task Force has come out with the new guidelines which say no mammograms until age 50. From 50 to 74, mammograms every 2 years, and then from 74 afterwards, you don't need them. That is sort of in contrast to the American College of OB-GYN, which still maintains every 1 to 2 years from 40 to 50, and every year 50 and up. So it really depends on what guidelines you want to follow for that.
All right, and we're going to give you those websites. You can check them out afterwards. The number 2 test that every woman should have each year, Pap Smear?
Pap Smear is equally controversial changes.
Yes.
The recommendation now from the American College of OB-GYN is that there does not need to be any Pap smears until age 21, which is a change. From 21 to 29 every 2 years, and probably from 30 and up every 3 years. A lot of that really depends on your HPV status or your human papillomavirus status, which is what we know now causes cervical cancer.
As a doctor, do you recommend that ladies get both the mammogram and the Pap smear every year?
Depending on their age. So I generally do not. The mammogram, yes, but especially the Pap smear, you really do not need that every year. Okay. Probably every 3 years is sufficient.
Every 3 years. All right. Number 3 is the colonoscopy, mostly after 50, I'm assuming here.
Yes, mostly after 50. Nobody wants the colonoscopy, and often I see patients year after year after year who are still not getting it. And that's primarily because of the preparation. The preparation for it is unpleasant. However, it is the best way to pick up colon cancer as well as precancerous changes. So it really is a must-have.
A must-have. All right. Blood tests, another way to pick up on lots of cancers or cholesterol.
Right. And I think that's probably the big one, is to look at lipid profile or cholesterol, as we sort of call it. And that should probably be done sometime in your 20s just to sort of get a baseline. And depending on family history and age, you should get it every probably 2 to 3 years afterwards.
All right. Number 5 is the thyroid screening.
Thyroid screening, there's no real formal recommendation, but the American College of OB-GYN suggests that at 50 years of age you get a baseline thyroid screening. Thyroid dysfunction does increase as we age, and especially for women.
Okay. We want to go through these quickly now. 6 is osteoporosis, and we worry about that as we get older.
Osteoporosis, or looking at your bone density, is a great idea to do probably after menopause, and so some recommendations is 65.
Okay, 65. All right. Number 7 would be skin tests for skin cancer and other things?
Skin testing you should definitely do every year with your visit to the OB-GYN, and that is really looking for moles or precancerous changes to get them early.
And then finally, number 8 is depression screening. We don't think of that, but you do that with women.
Yeah, depression screening especially, and that can be done every year at the visit. And as women age and get to that perimenopausal and that menopausal transition, depression is often an issue.
All right. Thank you so much, Dr. Montalto, for
pleasure.
joining us. We so appreciate it. And so if you have any questions about women's health or these 8 tests, just go to our website, WTEN.com. Click on links. We have linked you to the American Congress of Obstetricians and Gynecologists, where they have information on these different tests. And for more information, Lydia.